Hi, I'm Dr. Laubach from Back to Health. And in this video, we're going to talk about neurodynamic mobilization, also known as nerve gliding or nerve flossing. We're going to speak specifically about the sciatic nerve. The sciatic nerve is a large nerve that exits out of your lower back, travels down the back of your leg and all the way into your foot. And when that nerve is pinched or irritated, it can produce the classic symptoms known as sciatica: pain, burning, numbness, tingling down the back of your leg, in your calf, or all the way down to your foot. Now, when the sciatic nerve exits out of your lower back and begins to work its way down the back of your leg, it has to pass through a variety of different soft tissues, including muscles and ligaments. And there are points where the nerve, as it passes through these soft tissues, it needs to be able to glide nice and smoothly. So when we're walking, when we bend at the waist, when we go from sitting to standing, some studies have said that the nerve needs to move 3 to 4 centimeters, which when you think about it is quite a bit. For a variety of different reasons, what can happen over time is at these points where the nerve should be gliding nice and smoothly, we build up what are called adhesions. And what that does is it kind of entraps the nerve. So instead of gliding back and forth nice and smoothly, it kind of stretches and irritates the nerve. Nerve flossing movements are designed to break up those adhesions and to restore natural movement to the nerve. In theory, that should produce a reduction in your symptoms. Let's talk about a couple of important concepts before we get into showing you the exercises. First of all, to go from a point where you've got adhesions, where those nerves are kind of stuck and getting pinched and pulled, to a point where they're gliding nice and smoothly and you've gotten rid of all the adhesions, it is a process. Optimal results are generally felt in a period of weeks to months. And certainly in the beginning of doing nerve flossing, when the nerve is very irritated and painful, you've really got to take it easy. This is one of those things where in the beginning, less is more. And then as you begin to improve over time, you can push yourself a little bit further and do the exercises a little bit more frequently. Most importantly though, if you're doing these nerve flossing movements and over a period of days, you get a sense that they're making your condition worse, just stop and talk with us at your next appointment. Now, when you're doing nerve flossing for your sciatic nerve, there's 2 different positions that you can do it in. One of those is in a lying position and one is in a seated position. We're going to start out by showing you the lying position first. The first position we're going to show you for flossing the sciatic nerve is laying. This is the least aggressive of the position and is generally good to do when you're in a lot of pain. This is a good place to start. We're going to pretend like my left leg is the one that has the sciatic nerve pain going down it. So we're going to start working with that one first. What I'm going to do is I'm going to elevate my leg to 90 degrees. We've got 90 degrees at the hip, 90 degrees at the knee. Most importantly, what we're going to do first is we're going to extend the foot back. We're going to lock that foot back into extension. Once we have the foot locked into extension, we're going to straighten our leg to the point where we feel some tension on that sciatic nerve. Tension on the sciatic nerve is going to feel like almost like a hamstring stretch. You might feel tightness down the back of your calf, maybe even a little bit of numbness and tingling into your toes. Once you have those sensations, you're going to get to that point where you have those sensations. Very importantly, you're going to back off of those sensations just a little bit. So we're going to drop our leg down just a little bit, get rid of some of that stretching feeling. And then we're going to go through the movements. We're going to pump our foot. We're going to push it out. We're going to pull it back. We're going to push it out. We're going to pull it back. And certainly conceptually, hopefully you understand what we're doing here. We're getting our sciatic nerve to a point where it's very tight and at a point of tension. And then just like you floss your teeth, we're using our foot to move that sciatic nerve back and forth. I want you to go through this movement about 5 to 10 times. And then assess how that feels for you. The second technique for nerve flossing for the sciatic nerve is done in a seated position. This is definitely a little bit of a more aggressive nerve flossing technique, which means it does get much better results. However, in the early on phases when you're in a lot of pain, you might want to just do the laying down position for a couple days to a week until you start feeling like your pain's getting a little bit better, and then moving into this seated position. This position has two different positions to it. The first one is going to be one where everything is in contraction, and the second one is going to be where everything is in extension. Again, we're putting slack into the sciatic nerve, and then we're stretching the sciatic nerve. So here we go. Position number one, we're going to hunch over, and we're going to tuck our chin to our chest, and we're going to point our affected leg, we're going to point our toe down. The second position is simultaneously extending our leg and our foot, sitting up tall and going into extension, and extending our head backwards. So the move looks like this. Everything is in contraction. We're slouched over. Everything is in extension. Good. We go down to flexion. And then we go into extension. Let me give you a side view of that. Again, we're going to go through this movement 5 to 10 times, and then we're going to assess how our body responds. Flexion, toe pointed down, slouched over, chin to chest, leg extended, toe to the nose, back into extension, neck into extension, and then go back into flexion again. Let's talk about an overall strategy of using nerve flossing movements to help your recovery at home. As I said in the beginning, it's better to ease yourself into these movements than it is to overdo it on day one. So when you're in a lot of nerve pain, it's probably best to just start doing the laying nerve flossing movements twice a day. Do them in bed in the morning, do them in bed at night. Assess the next day how things go for you. Is there a sense that it's helping you? Is it helping you improve? If you get that sense, you can start doing the laying movements more frequently throughout the day. Get up to a point where you can do them like every 2 hours and you feel like there's still continued improvement. Then start adding in the seated nerve flossing movements. And again, maybe once a day, do the seated nerve flossing movement, reassess how you feel with it. And then as you start to improve, replace the laying nerve flossing movement with just doing the seated nerve flossing movements. It's a much more aggressive movement, it's much more effective, but it can be a little much when you're in a lot of pain in the beginning. These exercises work best in combination with our other recommendations for your condition. Be sure to follow our recommendations for your in-office care and your home recovery plan. Be sure to check out our other videos on sleeping position, proper bending and lifting techniques, and our stretching and strengthening routines that are recommended for your condition. As always, if you have any additional questions, make sure you bring them with you to your next appointment or shoot me an email. We'll do everything we can to participate in your recovery so you can get back to health today.